I'd like to see social work take the lead in addressing the human condition. I'd like to see them take the lead in addressing the needs of the disadvantaged and in addressing the needs of marginalized people all over the world. I think we're doing a great job, but I feel that we can do more in the role of leadership in these areas.
That kind of thinking is typical of Jean Tucker-Mann. Moving mountains and still wanting to do more. And for more people.
Social work has shaped my life because it has given me the professional tools that I need to follow what I feel is my life's mission. And that is to make sure everybody is afforded freedom and everybody's rights are respected. See, they're still dealing with this gay issue and the fact that they don't have benefits. And yet these people have been living together for quite some time. And they're contributing and all the rest. So why should they be denied access to federal benefits? I think it's an absolute disgrace.
Jean's body of accomplishments reads like a textbook on the social work profession and includes Human Resources Executive Aide for 2 administrations, a mayor of Baltimore, and a governor of Maryland, deputy regional director for Baltimore's Department of Juvenile Services, school teacher, associate professor, the list goes on, and is highlighted by her decade as director of social work and human services at the University of Maryland Medical Center.
And now we can
Ellen Butler is the department's administrative coordinator.
I worked for Jean for 10 years. I never had grown so much in a position as I did with her. Jean knows how to get things done. She has a way about her that it's evident in how our department's grown. Another thing too is Jean helped start the palliative care program here at the hospital.
The palliative care program Jean spearheaded now serves hundreds of patients each year and continues to grow.
It's the idea that even when a patient cannot be cured or they cannot be healed, there is still so much more that can be done in terms of making that patient very comfortable, both emotionally and physically and spiritually, if that's what the patient desires. I experienced my mother's illness, and palliative care was not available to her, and I wanted to make sure anybody who was experiencing the kind of illness she did had that kind of service available to them.
While now officially retired from the University of Maryland Medical Center, Jean is still very much a part of the family and a valued voice, as President and CEO Jeffrey Rivest makes clear.
She is the epitome of what you want your social work profession to represent. Highly respected here at the medical center, worshipped by our families and our employees. I always look to her as a great source of wisdom for me. And in the years that she worked here, I never hesitated to call her to say, give me the real story, Jean, on what we need to do to improve this for our patients and families. And her wisdom, confidence, and integrity always helped me understand the bigger picture.
As Dean of the School of Social Work, Richard Barth echoes those sentiments.
I can't even begin to tell you the number of places where she has had a huge impact in our communities, from Philadelphia to Annapolis to Washington, D.C., and across the country, as well as here on the University of Maryland campus. Jean was a leader in the social work department, one of the oldest social work departments in the country. She led it for nearly 10 years and developed methods that are still in place now. In addition to working on palliative care, she also helped the hospital to advance its work around cultural diversity. And all of that has recently paid off in the hospital being given an award as one of the hospitals of the decade. So that wouldn't have happened if it wasn't for Jean Tucker-Mann.
Even in so-called retirement, Jean's pace remains impressive, what with her clinical management consulting, private practice counseling, and continuing education work. But she still finds time for young people coming up through the social work ranks.
I had the opportunity to be mentored by many people who were in the same fields in which I worked. I believe now that it's my responsibility to do that with youngsters who are moving along in our profession. I will always mentor young women, young men, and try to have them benefit from the experiences I have had.
Ultimately for Jean, social work is about the satisfaction of giving back.
Seeing people thrive, seeing them become productive citizens in spite of the odds they face is one of the driving forces that has kept me in social work. It is not the highest paying profession there is, but the rewards and the benefits that one gains from working with folks and seeing them become productive and see them lead lives that they want to lead is very rewarding.